the next I'd probably just look at how you move, how you function a little bit. So we're looking at Mark in ordinary balance. Close your eyes and be ready to catch. So perhaps have the bench behind the patient at this stage. But I just want to know, how able is Mark to balance without using his vision? So that's all I'm really going to learn from that. It's not diagnostic, but it just tells me how much you're using your eyes for balance. And if you're very wobbly, that tells me you're using your vision quite a lot. Can you stand on one leg compared to the other? So stand on your left leg, start off with. That's pretty good. Stand on your right leg to start off with. And if you have a vestibular loss, you will probably, thanks Mark, you will probably lose some tone on one side. So if I have, for example, a vestibular weakness on my right side, I may have good balance on my left, but be a little bit wobbly on my right. Now, that's again not diagnostic, but it just makes me think, okay, is there a vestibular issue, or is there just a hip replacement or a sore knee or a sprained ankle or something else gone on in the past? So some basic balance like that. And then a fun test, which you may not have come across, is something called a step test, where we ask the patient to march on the spot, keep on going, eyes closed, and we see where they end up. And some patients will do great deviations around to one side, and we keep doing that for 20 seconds, basically. So keep on going, and we'll see where you end up. And some patients will turn 90 degrees or even 180 degrees. And this is not diagnostic in any way, but it does give me a clue as to how well the patient knows where they are in space.
Yep.
Now, Mark is staying pretty straight, so there's no issue there. Thank you very much. Okay. But again, some therapists will say, or clinicians will say, that points towards a vestibular loss, but it could be proprioceptive or weak muscles on the hip. It's not diagnostic in any way. But it's useful. And if that fits with other tests, then it's likely to be relevant, and we can always reassess that as the patient goes through rehab.
Whenever somebody says something like that, when I've been on a course, they say, well, we do this, and they say, well, you might see this happen. I'm always thinking, what do we do with this information? And you said it's not diagnostic, so at some point we've got to work out why your patient turned 90 degrees or wandered off to the local
All it
shops.
tells me is that the patient doesn't know where they are, and they think they're probably going to the right, and therefore they deviate off to the left. So it's an indication of how good their picture in space is, and their cortical perception, if you like, is.
Right.
Because one of the outputs of the vestibular system is spatial perception up here. So it tells us where we are in space, which is why I'm stood upright and not falling over.